Again, we would be assessing the cardiovascular system and looking for a heartbeat anywhere between 110 and 160 beats per minute. Upon auscultation of the cardiovascular system, we could expect to hear a murmur, which would be a completely normal finding, something we would just monitor. Upon assessing the respiratory system, we'd be looking for respirations in about 30 to 60 beats per respirations per minute. And we could see a little bit of apnea, which is a normal finding. What we pay attention to is any signs and symptoms of respiratory distress. So if there were any type of retractions within the costal region, if there was any type of nasal flaring, or if there was any signs and symptoms of grunting. Again, these would be something we would just monitor at this stage. Moving on to the hepatic system, we would look for signs of jaundice, which is be a yellowing of the skin that follows a head to toe pattern. And we don't like to see jaundice go past the nipple line. So, we would monitor that. But with this child, we don't have any signs and symptoms of that. We'd also assess the blood glucose via a heel stick, and we'd be looking for a number between 40 and 80 milligrams per deciliter. We'd monitor the renal system, and in order to do so, what we would do is we would look at the diaper and output, and especially on breastfed babies, we could expect to see what be referred to as brick dust, which basically would be like a reddish tinge urine, which on breastfed babies, due to the decreased amount of volume they receive, would be a normal expectation. We would assess the immune system through a blood cell count, and looking at the white blood cells, we would expect about a 10 to 30,000 white blood cell count. We'd also monitor the metabolic and GI system via the first stool. So again, with the diaper, we'd be looking for that meconium, and it should be dark, like a black or green color. If we see that, then basically we can conclude that the metabolic system and the GI system is sound, as well as it confirms anal patency. With the neurological assessment, we basically assess their head size. The head size should be about a quarter of the body size, and we'd look for any signs of jitteriness or tremors, maybe seizures. These could indicate like a central nervous system abnormality or drug withdrawal, or even hypoglycemia. So we would monitor for that. The thermoregulatory system, we would monitor through an axillary temperature, and we'd be looking for a range of about 36.5 to 37.5. We'd want to make sure that the baby didn't get any type of cold stress, because they're such bad regulators of their temperature. So we would assess that first temperature at about an hour after birth. Moving on, we'd move to the reflexes, which several of them could be initiated. We'd initiate the rooting reflex, where depending on which cheek we touched, the baby would kind of turn their head toward that side. We'd also initiate the sucking reflex with a gloved hand. We would put the finger inside the mouth and the baby would suck on it, as well as it should swallow. We'd also look for what's called a palmar grasp, where if we put our finger inside the palm, it should grasp our finger, as well as it would do it with the bottom of the foot as well, which would be referred to as the plantar reflex. We would move on to the Moro or startle reflex, which could be initiated by holding the baby and generating a sort of dropping sensation, which would make the baby kind of open their arms in an abductive manner, in kind of like a C formation with the fingers and toes spread apart. Or we could create a clap type sound, which would also startle the baby and initiate that Moro reflex. We move on to the tonic neck or fencer reflex, and depending on which side the baby turned its head to, it would extend that arm and flex the opposite arm. So if the baby's head turned this way, it'd extend that arm and flex this one. The Babinski reflex could be initiated through upside down J on the bottom of the feet, which would spread the toes open. And a crawling reflex would be initiated by the baby. If you put it in a position to crawl, it should kind of initiate a type of crawling action. At this stage, you'd assess the New Ballard score to assess the gestational age by initiating several different positions on the baby, looking for the level of and degree of physical mobility. So you would bend the wrist, scarf sign, various different positions to assess what degree the baby is able to have range of motion, which would give you an estimated gestational age for the child at this stage, which would either coincide with or go against what our initial belief was. And that concludes the newborn assessment.